Hi, I'm Marty Finkler. Bill McLaughlin and I would like to welcome you to another interview. This one will be with Sarah Wright. Thanks for coming, Sarah.
Thank you, Marty and Bill. It's great to be here.
Terrific. Today we're going to talk about one of the major determinants of health. The literature on the determinants of health cites clinical factors and socioeconomic factors and behavioral factors and environmental factors. And Sarah's going to talk to us a little bit about some of those, and in particular about her project, which she is the program director for, The Way to the Fox Valley. But before that, Sarah, please tell us a little bit about your background.
Great, I'd be happy to. So I actually spent a good portion of time, about 15 years, working in the private sector in business in information technology, and through that process got a master's of business administration and really learned about the business aspect of implementing large projects. And then decided to go back to school to get my nursing degree. And so worked as an RN in the hospital setting for a bit and really became sort of disheartened with all of the challenges that people in the community face with disease and lack of health, and studied a little bit more about the relationship between our lifestyle and how we can actually prevent disease and really catch things on the front end and try to create a healthy community. So I became involved in public health, and I've been in public health for about the last 6 years as a nurse.
What did you envision when you took the job as the program director for Way to the Fox Valley?
Yeah, that's a great question. Way to the Fox Valley is really about looking at those social determinants. How do we create an environment and a culture that supports people's desire to be healthy and really try to create that culture of health in the Fox Valley and the Tri-County area of Winnebago, Outagamie, and Calumet counties. And that's a huge challenge and a huge undertaking. And what I saw right away is the strengths of Way to the Fox Valley is all the great partnerships and organizations really trying to do this separately, but how do we bring them together and really try to all steer the ship in the same direction and really achieve this huge long-term sustainable change of creating that culture of health in our community. And so I envision this wonderful place to live where healthy living is the norm, and it's easy for people to adopt a healthy lifestyle and be active and be social and eat well and really have that exposure to this positive health message throughout the community that they live.
Terrific. You mentioned one of the challenges, bringing these various organizations together. Talk about some of the opportunities and other challenges that make your life fun.
Sure, lots of fun every day working on these challenges and opportunities. So, we try to look at the community holistically and how do people live, work, play in their work site or in the community itself or in schools, childcare settings, healthcare. Really it all interacts together, and so we're trying to look at strategies of creating that culture of health that is reinforced everywhere you go. And you think about how big and broad that can be. For example, in the community, we look at things like how can people be active to get from point A to point B? Do we have safe pedestrian access? Do we have bike lanes that people can use to either for recreation or for that transportation? We look at all these strategies that we know are proven and we know can be effective and have been effective in other communities. Again, looking at schools, is it safe for kids to walk to school? Do they have reinforcement of healthy eating options? And do they hear the same kind of message that their parents are hearing in their work site? And all of this really has been proven, and we know that this multi-sector approach across this whole community is this huge opportunity, but then we do bump up against, how everything kind of takes time, resources, and money, really. And so we also find ourselves out there looking for funding in a variety of places. There's grant programs, and it's just this balance about how do we identify these opportunities, how do we create this culture of health, and how do we find the resources to really make it happen. I mentioned all the partnerships that we have in place, and I think that's a huge strength that we have in our community, but everyone's capacity is somewhat limited when it comes to, okay, how do we go and make this happen and create this here? And really, that has been proven that it can happen, but it's something that we really want to see, and we have this vision that we really want to see come to fruition here in the Fox Valley.
Okay. So that leads to the question, what would it really take to be successful, and what would that mean for the community?
Wow. I love when I get to dream. I tend to be an eternal optimist, and we think about this. What would the world look like, and what would it take to get there? I think what it would mean for the community is that people could really be healthier and live better. As you mentioned, the social determinants, the environment has an impact on our health. So the environment we live in, if it really supports that health, is going to be a big factor for all people in the community. Right now, some people might have access to these opportunities, but maybe it's not affordable and not accessible for everyone. But we envision a community where everyone has access to these same opportunities to live healthy. And really, I think of like turning health, the system of our health upside down and just completely reinventing it. A paradigm shift around. We try to keep people healthy from the beginning and really throughout their lifespan, so that people don't have to face as many challenges and expenses and dealing with all of this chronic illness and challenges with weight and these things. So to do that, we are up against so many things, like messages that we receive that really go against our desire to make healthy choices and to live healthy. And we need to counteract that. We need to bring resources in to give people a different message and a different view of the world, and really create that culture of health. And communities have done it, but many times it's just millions of dollars. It just can be a really big undertaking. And so we're trying to figure out to set in motion, what are the things that we can do together to be healthy, and to create this healthy culture and community. But then how do we find those resources to really make it happen well?
Can you think of an example of a community that has made this kind of transition, this transformation from being sort of the average American community to being the kind of healthy community that features the culture of health that you're talking about?
Yeah, so there's some examples out there. One that was studied early on when Way to the Fox Valley was formed is Somerville, Shape Up Somerville. Really came at this holistic approach. So how do we look at the retail setting and the school setting and the community setting and really bring that message? New Ulm, Minnesota has done some of that work. There's just pockets of communities that have really done it, but taken a major resource, in the maybe tens of millions of dollars to really try to flood the community with this health and make it happen.
If we could take one big step, what would be the first step we should take?
I think, one of the things that we're trying to do with Way to the Fox Valley is sell this, right, if you will, like really looking at the examples and what can be done and what can we move the needle on, right? We look at, in Way to the Fox Valley, we look at BMI and weight as a overall measure of the community's health, and we know that things that contribute to that include things like being physically active and eating well, and we want to move the needles on those things, but we need to really demonstrate that so that we can prove to those that might have the opportunity to help us by committing their support and resources that this is going to be worthwhile, and we know what we're doing, and we have the leadership in place to make it happen and the partnerships in place.
The determinants of health literature suggests that only 20% of what affects health status is related to what happens in the clinical sector. Your project is an attempt to go at the biggest chunk, the behavioral chunk. So if you're successful, or if the kinds of projects that you just detailed for us are successful, what would be the effect on medical costs?
That's an awesome question, Marty. Medical costs is such a huge burden on our community and on the individual, and we're always looking for ways to improve that. And it seems sort of obvious to me. The research is clear that the lifestyle that we live is going to have an impact on either delaying or deferring or not, leading us away from these chronic diseases that cost so much money in our community. So if we can make an impact on that, that's going to drastically change the cost of healthcare for people and really make a difference in our community. So if we could take some of that money that we spend on helping people manage disease and on that medical care and divert it and focus into prevention, into upstream, and having people stay healthy, then it's just going to be better for all. And and it's going to help with that overall challenge of the cost that we spend for healthcare.
Terrific. Great. I look forward to if we can do that. Thanks so much, Sarah.
You
Appreciate
bet.
the time.
Thanks, Marty. I appreciate it as well.